Good evening, everyone. Good afternoon, shall I say. Welcome to our town hall with Duke Health. Today, we're going to talk about staying healthy for the holidays amidst this triple threat of RSV, COVID, and the flu. I myself was just diagnosed with the flu about a week and a half ago. So, this topic, all the information we're going to find out today is extremely important to me. I am one of your hosts. I am Melissa Wade from the Light 103.9.
And I'm Karen Clark from Foxy 107, 104. And so basically, we should have done this 2 weeks ago, Melissa, so that you could have avoided the flu. And thankfully, I just want to let everybody know she has been unable to infect anybody here at the radio station. We keep our distance from.
I'm good now. I'm good. But, I had to go through some steps that I'm sure these doctors are going to share with us so that, I couldn't find out the information before I got sick, but that's what we're here today for is, before everybody gathers together for the holidays, we want to make sure they know what they need to know. Karen.
Yeah, we want to keep everybody well.
Absolutely. So today we have some wonderful guests that's joining us. We have some wonderful doctors from Duke Health.
Mm-hmm. Let's kick it off with Dr. Bobby Banks, who's joining us. Welcome. Thank you for joining us today on our Facebook and YouTube Live. Tell our audience a little bit about who you are.
Well, number one, thank you for the opportunity to come and talk a little bit about our work. And I also want to acknowledge that today is World AIDS Day, December 1st. So wearing my red for that. But I am Dr. Bobby Banks, and I'm the CEO of Pillar Consulting. And my company has spearheaded an effort called Not a Host, that if we have more time in this session today, I'm happy to share more. But we've been working with the community to develop messaging from the community, by the community, for the community. And we've had support from Duke Health, and I'm so happy to be here just to share more about kind of that translational piece between the medicine and clinic and really making it messaging for public health. So I thank you for the opportunity to be here and to share this platform with other doctors, whether they are in public health or in medicine, to share more about the importance of how to move safely with our families for the holiday.
Wonderful. Dr. Banks, we know that you're out there helping out those grassroots and community-based organizations and nonprofit organizations, and you do such a great work. We're glad to have you. Also joining us is Dr. Thomas Holland, MD. Dr. Holland, glad to have you to be a part of this wonderful town hall today. Tell us a little bit about yourself.
Yeah, thanks, Melissa. I'm really glad to be here as well. And I'm glad that you're recovering from flu. I'm sorry that you had that. Yeah, it touches all of us. So I'm an infectious disease doctor here at Duke Hospital. My role in the COVID pandemic has largely been that I helped set up our inpatient and run our inpatient unit when we were taking care of, first figuring out how to take care of patients who were hospitalized with COVID. And that's included both taking care of patients and then also conducting clinical trials as we tried to figure out strategies or treatments or ways to help patients get better. And like you, this touches all of us. My 97-year-old grandmother has avoided COVID or a respiratory infection for 3 years of this until this Thanksgiving, and then you had a gathering, and she's pulling through now, but became ill with COVID as well. And so we're still, I think, as tired as all of us are of having to think about COVID precautions or flu precautions or now RSV precautions. We're still in this thing and still need to make the kinds of decisions that keep ourselves and the people around us as healthy as they can be.
Wow. Well, I'm sorry to hear about your mom, and I'm glad that she is recovering. It's not over. And it's in addition to it's not being over, it's like we're adding on top of everything that we're already dealing with. So I'm glad we're doing this today. Next joining us is Dr. Adia Ross. Thank you, from Duke Regional Hospital. Thank you for joining us today. Tell us a little bit about yourself.
Yes, thank you for having me. My name is Adia Ross. I'm the Chief Medical Officer at Duke Regional Hospital. I'm an internist by training. I'm also the highest ranking doc in the hospital here, and have been in charge of making sure that physicians like Tom and others have the resources that they need for taking care of COVID patients. I also was our medical director of our COVID clinics. Like Tom, made sure that our patients had access to our COVID clinical trials during this time, and also have seen and rounded on patients with COVID. And so, we've all suffered losses through these last 3 years. I actually lost my uncle to COVID, and we've had family members that have also survived. And so, it's been a crazy time. And the good news is, we are at a different spot than we were 3 years ago, but the basics are still the same, to prevent the spread of respiratory viruses and allow us to fellowship with each other during the holidays, because that's very important for our mental health and to stay connected. So I'm happy to be here and to talk about the work that we're doing at Duke Health to help partner with people like Bobby and you guys to help keep everybody safe.
Well, again, we are sorry to hear about your uncle, but we are so glad to have you as part of the team with all of your credentials. It is such a blessing to have someone like you to be there. And where you're located is, as they say, my neck of the woods. So, if anything else happens to me, Dr. Ross might be coming to see you. And finally, joining us today is Bishop Darren B. White Sr., who is the bishop there at Victorious Life Fellowship in Durham, North Carolina. Bishop, how are you? And tell us a little bit about yourself.
Okay, thanks, Melissa and Karen, for having me this afternoon. I'm so privileged to be here. I am the senior pastor, as you mentioned, at Victorious Life Fellowship Church. I've been pastoring this church for 15 years. I've been blessed to serve in that capacity. We're located 4124 Fayetteville Road in Durham. Also, prior to this vocation, I was an employee with GlaxoSmithKline, which is a pharmaceutical company here. I retired there about 5 years ago after working there for 26 years. So I know a little bit about clinical trials and about vaccinations. And I was just blessed to be able to serve in that capacity there for that number of years. But now my focus is on ministering to souls. And also when you do that, you minister to the totality of humanity. And so I'm just privileged to be a part of this discussion, and anything that I can glean and bring back to my congregation or even to those other churches that I cover, I'm just more than pleased to do that. Also, I noticed that everybody has been touched by COVID or the flu or RSV. And 2 years ago, I lost my pastor to COVID. July 20th, Bishop William Spain went on to be with the Lord due to contracting COVID, which at that time we didn't have a vaccine. So, this is really near and dear to me.
Well, thank you, Bishop, for joining us and participating in this discussion. So let's go ahead and open it up because we've got questions and people need answers. So between the flu, COVID, and RSV, we've seen lots of community illness. What should we be doing to educate people so that everyone can be safe? I know that people are just sick and tired of all of this, but we still have to talk about it. We still have to address it. How can people be safe and gather and still live our lives despite this triple threat that we are dealing with right now? And I'm opening that up to any and everyone.
I can say from a health education perspective, we've had an opportunity to work with youth for the last few months, ages 10 to 18, and community health workers who I called our seasoned babies. And what we really want people to think about and focus on, because we know there's a lot of information, is risk and informed decision-making. That's it. So what I say to our young people is what you got or don't have, and how you're going to move given that information. And so at a minimal level, how do you know if you have COVID or not, right? People can say, I'm not sick, but how do you know you're not sick? Have you taken a test to make sure you're good? And then if you're good, you still want to make sure you're moving below the radar. And so as part of our work with Not a Host, we really want the community to understand that you can be sick and not have symptoms. Or if you're waiting for symptoms, like you waiting on perhaps, Bishop, you probably have people waiting on Jesus, right? You could have infected people 4 or 5 days prior to that, right? And so just really helping people understand, and I'm sure our physicians can speak to this, the importance of knowing that you could have COVID and you may not have symptoms, or you could have symptoms. But one way to be very, very clear with that is testing. Another way is making sure you're not giving the virus an opportunity to be here, there, and everywhere. And they'll tell you the importance of vaccine. And then we know back to elementary school, cough catcher, right? We don't walk around and cough and sneeze on people. We don't do that. And so just at an elementary level, put your mask on, right? And think about moving in smaller groups until we are out of this pandemic. So those are some of the things we're reinforcing. We know that so much has changed in this pandemic, but what has not changed with respiratory viruses is the need to cover up your nose and your mouth, right? And making sure that you're moving wisely and you're testing to make sure you know whether you're negative or positive. And our physicians can speak to that as well. But those are some of the things we're talking about, because as you have said appropriately, people are tired of talking about it and hearing about it. But there are very simple things we can do to stay safe and make sure our loved ones are safe.
Dr. Ross?
Sure. Was Dr. Holland about to say something? I think I'm happy to let him go first.
Oh, either way, yeah, I was just going to pick up on that. I think Bishop White and Dr. Banks have hit some really important points. I remember 3 years ago when we were first starting to take care of patients with COVID, and we certainly didn't have a vaccine, and Bishop White referred to that. We didn't even really have testing. The first patients that were coming in the hospital that we were worried they might have COVID, we were sending off testing to the CDC. It took a week to get a result back, and just contrast that with where we are 3 years later, where you can go to CVS or Walmart or anywhere and pick up an over-the-counter test and test yourself. And you can get vaccinated. There are vaccines that are safe and effective for people of all ages. And so, 3 years ago, we learned how to prevent transmission with what are called the non-pharmacologic measures, or things like masks and hand hygiene, because those were the only tools we had in the toolkit. And so we were doing social distancing and staying at home and wearing masks. We learned that works. It's painful, right? If you're like me and you have kids that had to do virtual school from home and had to do all these things, then it's painful. We have more tools now that help us be safe and healthy than we had a few years ago, and that's really empowering. I hope that's part of the message. You can safely gather with your loved ones by testing, by wearing a mask, and by being vaccinated. And so that puts us in a really different spot than we were in even a year ago, but definitely compared to 2 or 3 years ago.
Absolutely. Dr. Ross?
I was going to say that's well said. I think Dr. Banks and Dr. Holland really covered most of the things. I think it's really important to remember, again, those basics and just reinforcing just how blessed we are to really have vaccines. We don't have a vaccine really for RSV, but we do have for the flu and for COVID. And remember, it's twofold reason. Number one is to prevent hospitalizations and overwhelm the system, so that if you were, God forbid, get a car accident or break a bone, that the health systems are not overwhelmed. And then 2, to prevent death. And then 3rd is really prevent you from getting sick yourself. But, sometimes depending on how these viruses are continuing to try to evolve, we may not get in the vaccine the perfect cocktail or to prevent you getting any symptoms. But the goal is to prevent hospitalization and death. And so those still are really important. And if you have risk factors, or you live with someone, or you're going to be visiting and fellowshipping with people that have issues such as even being overweight or having diabetes or heart problems, it's really important that you get vaccinated to protect others. And so that's the foundation. And if you've been sick, you shouldn't really be out and going to events or church or other things if you still have a fever. And if you have symptoms, you just need to wear a mask. And I think we need to continue to make it comfortable for people to say, you know what, I'm going to do the right thing by protecting you. And I still want to fellowship with you, but I'm going to wear a mask because I'm not sure. I know I don't have COVID, or maybe I don't have the flu, or I'm getting over it. But those are the best ways that we can still be together and keep our health systems operating and functioning, and keep our schools open by doing those things that we can do to protect each other.
Yeah. Can I ask a quick question? Because I feel like we jumped into this, and I've heard more about RSV in the past several weeks than I have in my entire life. So can we back up and talk a little bit about what RSV is?
Absolutely.
Yeah, I'm happy to take that one. So RSV, it stands for respiratory syncytial virus. So it's a respiratory virus. It's been around for a long time. Dr. Ross already mentioned it's not one that we have a vaccine for currently, although there are some vaccines in development that look promising. And it's one of these things that everybody gets, by the time they're 2 years old. It tends to cause the most severe illness in young kids, and especially kids under the age of 2. And so that's where we've seen the most severe illness in our pediatric hospitals, or among our young kids. But it can also cause severe respiratory illness in older folks, or folks that don't have a normal immune system, so have immune compromise. I mean, I think Dr. Ross mentioned that she's currently rounding on the wards and seeing patients at Duke Regional. I'm doing the same at Duke University Hospital. I have an adult patient with RSV pneumonia on my service now that I'm looking after. So it's a respiratory virus. It spreads the same way that COVID does or that flu does, with respiratory secretions or droplets. And after a couple of years where we didn't see a lot of RSV infections, but I think because there was so much COVID and people were taking precautions, we've really seen a resurgence this fall. And a lot of kids who have never been infected before are now kind of getting it all at the same time. So it's become a really common respiratory virus that we're seeing in the community and unfortunately in the hospital as well.
That's great. Karen, that was a great question. I was going to ask the same thing. For the doctors, of course, Dr. Holland just gave us an explanation of RSV. How can we determine the difference between the three? You know, whether if I have COVID or whether it's flu? Because for me, when I got the flu, I just thought it was, just something, a 24-hour virus. It'll get away, it'll go away. But then I couldn't break the fever. And I was like, okay, now I need to go and get somebody else to figure out what's going on with me. I was taking Tylenol, Motrin, this, that, and the other of what I thought would work. How can you distinguish whether you have one or the other, or is there a way?
Yeah, it's tough to do. Your point exactly. It's hard to do just based on symptoms. You can make some educated guesses based on how old somebody is, or maybe a little bit with symptoms, but they cause the same things. They cause that stuffy nose and maybe fever and feeling like you've been run over by a truck and all that kind of thing. And so it's hard to tell without testing. I mean, so the short answer is testing, and that involves showing up somewhere where you can be tested for flu, for RSV, and for COVID. One of the real revolutions in COVID is moving testing into the community where people can access it themselves. You can buy your own test, you can test yourself, and it turns out people are pretty smart and can figure out how to swab their nose and put the drops on the thing and do the test, right? Mm-hmm. We need to do that for other respiratory viruses as well. Right now, most of that testing for RSV and for flu is done in healthcare settings.
Yeah, and I was going to say, when you think about it, you might be like, well, some people might say, oh, I'm young, I don't have a lot of stuff, so why would I need to test? I think part of it is a public health thing, right? Mm-hmm. Because you want to know, and it helps us, if you go to the doctor, now granted, we have COVID home tests, but we don't really have that for RSV or flu, but that helps epidemiologists, public health professionals really get a sense of what's going on in the community and if we need to do anything differently. So that's number one, to test. And number two, because there are some medicines that can be used and you can really shorten your time with symptoms and also shedding and infecting other people. So that is the reason, if I have symptoms that are consistent, even if I know I'm probably not going to end up in the hospital, I'm going to test because I don't want to give it to my kids. I don't want to give it to my husband. Mm-hmm. And, if there's somebody else I'm around, we may be able to get some prophylactic doses, which means, like with the flu, you can get Tamiflu for other people that might be at risk. If you had a family member who has cancer and they're living with you, then that might change the decision. They might give them some medicine to try to prevent the flu virus from infecting them. Or for COVID, we have oral medicines that you can take, but it's a short time period for a lot of those medicines for the flu and for COVID to really work. So you really got to get tested and get on those medicines for them to be effective. And so those are some reasons just to test.
Can I add something about risk, if it's okay? I share this with, again, my young and my older people. And my late mother used to always say that I-95 runs both ways, right? And so just kind of really thinking about risk. I think some people, whether they're young or old, Dr. Ross, are just like, oh, I'm good, I'm going to be fine. Well, that's you thinking about you, but literally, and I had one of our partners say this, everything that everyone does affects everybody. Like, we are that interconnected. And so just thinking about risk of, I'm okay, I'm gonna be all right, but also knowing that this virus spreads through you coughing, sneezing, breathing on people, that you can be a risk to someone else. So you can think about your risk. You can think about your risk in infecting someone else. And then there's the bigger risk of both of you, going back to vaccines, lowering your risk of severe illness or death. So I really would like to heighten people's thinking beyond themselves and just being like, I'm young, I work out every day. Well, that's good. And it might roll right off of your shoulders. However, if you are at Thanksgiving or Christmas with, as you have appropriately said, your grandma who might have diabetes, my immune system, I just need a whiff of dust and my eyes like shut down. And so just thinking about people who live with other things every day and that you could be a risk to them. And so I would love for people to understand that risk can run both ways, and just to really think about your interactions with other people.
Yeah, and I would say, and I know Tom can probably say something to this too, but I think people have it's really hard to assess your own risk too, because there are patients that are like, even without COVID and RSV and flu, that really didn't understand, because health risk is very complex, and they come in with a heart attack and feel blindsided. But then when I would look at their labs and everything, and I'd be like, whoa, you're high risk for a heart attack. You're high risk for, going on dialysis. And so I would say people really, it's hard to underestimate, or excuse me, to really estimate your risk, because I have seen young people that thought they were healthy and ended up getting hospitalized. So I think that's another thing to say, Dr. Banks, is that it can be very hard for individuals, unless you see a doctor regularly, to really assess what your risk is. And so I think it's important for people to be seeing their doctors and talking through those things, and not just saying, oh, I don't need a vaccine, or, oh, I don't need to wear a mask in the grocery store because I'll be fine, because you may not understand that. And it's very nuanced. I don't know if Dr. Holland want to comment on that.
Yeah, you're totally right. I don't know. I cannot count how many times I had a conversation with a patient who was hospitalized with COVID, and who said, I'm not against vaccines. I just didn't think I needed it. I didn't think this was going to happen to me. Right. I'm me. I'm healthy. I'm fine. And gosh, I had that conversation a lot of times. And so I think Adia, you're 100% right. It's hard to look at yourself objectively and say, something bad could happen to me from these, and I ought to manage my own risk. And then I just would echo what you said. We're all connected. If we've learned nothing else from this pandemic, it's that what we do matters to everybody who's around us. We're one people in that regard. And so that, when I think about getting the bivalent COVID booster, which I did, a month or two ago, maybe I'm falling part of the same trap. I think I would do fine with COVID, but I'm around people all day that I don't want to infect, and that I want to protect both my patients and then people that I see outside the hospital.
Which takes us back to flu, because I feel like we've been talking about COVID, protect each other, look out for your fellow citizens. And so we've been focused on COVID the past couple of years, but the flu is still a thing. The flu is still out there. And just like you can get COVID and pass it on to someone, you can get the flu and pass it on to someone. And, I know that in our community, there are a lot of people that don't believe in taking the flu vaccine. If I had $1 for every person that was like, no, I don't take the vaccine because then the last time I did it, I got the flu and I don't want. So let's talk about the flu vaccine and the flu vaccine in combination with the COVID booster. Is it okay to get both of them at the same time? Let's talk about all of that.
Yeah, I'm happy to start with that. Sometimes I think the immune system needs a better PR person sometimes, right? And so I hear that too. Like, you get the COVID vaccine and you get symptoms from it. That's your immune system doing what it's supposed to do. It's seeing that vaccine. It's responding to it. It's creating antibodies, and that comes along with some symptoms: a sore arm, sometimes some headache or fever, and that's happened with flu as well. And so you're totally right, Karen. People will often say, "I got the shot and then I got the flu." Well, you probably didn't get the flu. You probably got some side effects of the vaccine that was your body and your immune system reacting like it's supposed to. So I think that's point one. And the other point about the flu vaccines, they're not perfect. Like they deserve a little bit of the reputation of not being totally effective at preventing flu. But what they're really good at, and I think Dr. Ross has alluded to this already, is they're good at preventing some portion of flu. Usually about somewhere between a third or a half of the cases can be prevented by vaccination. But then in people who get it anyway, if you get vaccinated and still get the flu, you're going to end up with less severe illness. You're going to be less likely to wind up in the hospital, to die of influenza, and less likely to shed for a long time and pass it on to others. So there are benefits from both for the COVID vaccine and the flu vaccine from preventing illness and then preventing severity of illness, even if you still get infected. Your question about whether you can get both at the same time. You can get the flu shot in one arm and the COVID shot in the other arm at the same time, or if you would rather split them up, then that's acceptable too. But they can be given together.
Karen, I'm like your friends. Listen, honey, I had not had the flu shot for years. I honestly wasn't around a lot of people either, but I love all things natural, and I could boil me some real good ginger tea, ma'am. Listen, but you also have to think about time and place, and we are in the midst of a crisis. Whether the people who say I don't see it on the news anymore, well, you also don't see child poverty or child hunger, or if you're waiting for that primer to really understand the level of this crisis, that's probably not a good indicator for you to say, I'm waiting for someone else, or I'm waiting to see it on the news. And so I've been here, there, and everywhere during this pandemic, but just sitting around and knowing that anybody in this room or on this plane could have any of the three things you just mentioned is enough for me to take my happy self to go ahead and get a vaccine. 10, 15 years ago, very different story, but we are in the midst of a crisis. And for me, we're talking about informed decision-making, right? To continue to move and socialize with people and not protect myself. It's kind of crazy. It was a no-brainer for me to go get the flu vaccine, and hearing how people are, I don't know if Melissa Wade wants to tell us how well she felt with that flu, but I'm told that it's no joke. I don't want it. And so again, just thinking about where we are still in the midst of a crisis. These physicians cannot tell us enough. The hospitals are already bursting at the seams. If you get a broken bone or a heart attack or anything else, just good luck and Godspeed. And so just thinking again about self and others, I will continue to have my ginger tea. I will continue to have my elderberry, and I slung my happy self in the clinic to go get the flu vaccine, because I don't know what other people are walking around with going back to risk.
Dr. Banks, you hit it on the head. I had the flu, and my symptoms from the flu were worse than when I had COVID.
Yeah, no, ma'am. No,
for
ma'am.
me. I had the flu shot maybe a week and a half. I think the doctor said it might not have gotten into my bloodstream, well enough to keep me from having it or having the high temperatures. But things do happen. But I'm one of those. I will get my vaccines, and you don't even have to ask me. So
I will continue to. Yeah.
That's about where I am. But to know that in a transition, know before you go. We're in the midst of the holiday season. Let's just be honest. Let's keep ourselves transparent. We have been locked up and locked in and closed in for 2.5 years. We are ready to get out. Thanksgiving, we want to be with our families. Christmas is coming around. We have these events. We have these church plays, Bishop. We want to come out to the church and we just want to fellowship. I mean, we're like, hey, but we still have everything that's going on. What can you all say, to kind of, what would you say for us that want to go out? We're excited about the holidays, but we also need to make sure that we stay healthy. And, what's the most important things of knowing before you go? Bishop, we have, the churches are opening and people are coming back in. You're wanting people to come back in, but what advice do you give to those leaders to protect those parishioners that are coming back into the church?
Well, first of all, thanks, Melissa, for asking me. One of the things we did last week, my family gathered at Virginia Beach. And so I had 3 adult children and then several grandchildren. And so my mom was there. We all got a house, went to Virginia Beach. But my youngest daughter called us a few days before and said, Mom and Dad, I'm not feeling well. And so I was really pleased. She called and told us that. But then she said, I'm going to take a COVID test. I have a COVID test. I'm going to make sure everything is all right. And I think she did that because she did not want to infect her grandmother that was in her 70s, and then also to spread the disease to anyone else in the family. So I just give her kudos for being forthright and telling us what was going on. And she tested and everything was good. So she was able to join us there in Virginia Beach. But also having a church, and we're a smaller church, we have a little over 100 people. But what we did when we opened up, we opened up probably 6 to 8 weeks after we were told to shut down and everything, but we limit our numbers to just 10 people. And over the months and years, we sort of expanded that number. So now we're fully open. But what we do, we still tell people, if you want to wear your mask, wear your mask. We have a temperature check station that when you come into the door. So you're doing that. We have hand sanitizer stations all over the church. And so even though COVID seems to be somewhat subdued and still on the rise in other areas, but we thought it best to just err on the side of caution to make sure that everyone feels safe when they gather. And it's funny that you mentioned this because my wife just texted me before this call and said, she's been talking to the children about the play and sort of getting them geared up towards the Christmas play. And so when you have that and we're having Christmas parties and everybody's coming together, we want to make sure that people feel safe. And I think as a leader, leader of my church, leader of a company, or any community leader, you need to convey the message that your health is important, and to make sure not only that you take care of your health, but the health of those who you're going to be around. And so if you have something, say something. If you feel something, say something. And it's all right to miss an event, because most of us, especially in church or in clergy, we have been able to be blessed to use various social media platforms where people can still watch our services, people can still give, they can do all of those things virtually if they're not feeling well. So I think that's one of the things that we've been fortunate enough to just really espouse.
That's great. Any of the doctors, I mean, not just church events, but there are so many other events that's going on. You know, we're excited to get out and get back into fellowshipping with one another. What can we do, or what advice would you give for those of us who are thinking about doing?
Yeah, I think Bishop White really articulated very well. I think it's always thinking about other people and putting others first. I've been vaccinated. I've gotten every single shot I can possibly get. But I still mask because I have some family members, especially around the time, 14 days ish before I know we're going to have a family event. I try to be if I'm going to the grocery store or other things, I try to be mindful of that. I still go to the grocery store. If I want to go to a concert, I'm still going to go, but just trying to minimize the risks that I could have to others, because I know that given all the vaccines that I've had, worst case scenario probably for me is that I'll have some symptoms, but there might be somebody else that is immunocompromised. Or how many times do people find out, they got a new diagnosis of cancer and they didn't even know, right? And I just want to make sure that I'm protecting those other folks. So I think it's really situational masking too, in situations where you may be higher risk to get something. I still am masking on planes. Other people may not want to do that, but like Dr. Banks said, I still am doing that. Still thinking about areas where I could be exposed, especially if I know that I'm going to be around someone else that could be immunocompromised. And I just think, too, I want to be able to fellowship with people. I do not want to miss a Christmas event. And so for me, if you want to say, let's say you're not really motivated by caring about others. If you just want to think about yourself and you don't want to not be in the family pictures because you got whatever you got, some of it's self-preservation and wanting to be there, right? And wanting so badly to be there and be able to be there with my family and friends. So that's why I think I've taken the approach. I think Bishop White's approach is really, a balance between that need for us to have that social connection, be able to be present and be smart about it, especially during these times, because, during the winter, I mean, these viruses used to be, or tend to be seasonal, but I don't know, last year, one of my children got the flu in August. Wow. So they're always around. The issue around the timing is that we're all inside and we're congregating inside. And so you're more likely to be exposed, and the air quality, as opposed to us gathering outside in the summer for cookouts. And so that's why things in the winter, you may have a different approach in the winter than what you have in the summer. And so that's where I see it as being more, situational about the strategies that I use.
I want to ask a question about the whole plane thing, since you mentioned flying. I flew with my son a couple of weeks ago, and I was literally like, how many masks can I wear at one time so that I can make sure I'm safe? How do you all feel about them eliminating mask requirements? Do you feel like there are places where everybody should wear masks all the time? Like, from a medical standpoint, would medical doctors prefer that masks just be required on planes at all times? How do you all feel? Can you weigh in on that whole thing with planes and masks and public places?
Yeah, I'll take a stab at that. I'm happy to. I'm with Dr. Ross. Planes are a place that I am still masking for sure. Like that's you're in. I'm not up in first class. I'm back. I'm there next to everybody, maybe in a middle seat. People right close to me, and so that's a place I'm masking. I recognize there's like a political and there are other dimensions to telling people they have to do something, and Americans don't like to be told they have to do anything. But I think from a medical standpoint, yes, masking when you're in tight quarters around people that you don't know, that have different exposures or outside your social circle, that's nirvana for viruses. So that's where you're gonna get exposed. So if you got to be on a subway car, or a train, or in a bus, or a place place like that, I think that's a good idea to mask. That's a separate question from like mask mandates and the political question, but I think medically that's the right thing to do.
Yeah, I mean, I was gonna say the same thing. It's just like, I know the air quality in a plane is supposed to be good, but if someone sneezes right next to you, I mean, so, I mean, and I'm like, okay, and I know and I think maybe some of us doctors have PTSD from what all the stuff that we've been through.
Right.
And so it's just like, I don't know when I'll ever feel 100% comfortable with, not masking on a plane or in a small thing, because you can still get it outdoors. If I'm like, in a concert all up on a whole bunch of people outside and I can't really socially distance and they're singing, then that's a high risk activity, So, I just think, you have to balance things out, and we do have this need to have individual responsibility, but just realizing again, those high risk activities and the timing of the year that really, really should affect what you're doing.
It's also, if you're on a plane, you're usually going somewhere that you don't want to be sick 2 days from now, right? Like that's the
Yes.
other way to think about it. Like I'm going somewhere, I'm going on vacation, or I'm going to visit family, or I'm going to a meeting or doing something. I'm on that plane for a reason, and that reason does not include being sick 48 hours from now. Yeah.
Oh my gosh.
Just out of
I agree.
that's a place to wear a mask.
I'm the same exact way. I'm giving a shameless plug to our youth ambassadors who created 3 videos that reinforce everything folks are just saying. So the titles are like Minding My Mask. I have full autonomy and freedom to wear my mask. The others are paralleling like so many other life circumstances where people protect themselves. Floaties at a swimming pool, putting on sunscreen, if you need help with a wheelchair or mobility device, and everyone minds their own business. And so I invite you to watch the videos that these young people made. And also, Karen, I've trained in epidemiology, and so I'm watching numbers. I was also raised with a mother who said when it's 80 degrees outside, that's when you can go play. So not at 79, 78.8,
Yes.
6.2.
Yes.
When it is 80 degrees outside, you can go play in your pool or play. We didn't have a pool, we were in the military, play at the pool. So for me in this pandemic, I am not taking my mask off until the numbers look remotely close to other diseases or infections or viruses that we've had. We should not be in a pandemic and it's like we're on a roller coaster with waves. That is not how any of this works. And so plane, train, or automobile, if I do not want your P's or your T's, I don't want I do not want any of that from any, I'm being facetious. But again, going back to risk. And so I wear my mask. I have a very nice air purifier that I've had the airline stewardesses, whispering in the aisle like I don't know what they thought I had, but I announced, 7-foot radius, 99.7 HEPA filter, just so you all know. And that's probably more than I need to do, but I want to arrive healthy. I want to engage with people in a healthy way, and I want to arrive home healthy. The second thing, I'm also a boundaries person. Anyone coming in my house knows you're going to swab immediately. As Adia has said, if you know we're going on a visit and we're about to go on a college tour, please limit your interactions with people for a good week or two. Like, please don't live your best life and then come to my house and then we get on a plane and get in a hotel together and you're literally, you're just, the virus is replicating inside of you. And so being very clear with people, we're about to have this, this event. We want everyone to arrive safely and leave safely. And so if COVID testing is part of that, you say that. If masking is part of that, you say that. Be very, very clear. But people know, do not cross my threshold unless you're ready for a swab and you plan to keep your mask on. That's me.
And you mentioned the numbers. I'm sorry, Melissa, I have one more question. You mentioned the numbers and you were saying that we shouldn't be doing this. What about the fact that we don't hear about COVID all the time anymore? I feel like it's hard for people to take things seriously when they don't hear about it. So what do you all say about the fact that we're not seeing numbers? I mean, it used to be that, obviously, I don't think we're at a point where we need to see the governor on TV every day giving a press conference, but it's almost like COVID doesn't exist. And I know there's a lot happening in the world and in the country and elections and things like that. But like, what do people do if they're not, I don't hear about it. So I'm not thinking that it's a thing.
A major issue. Yeah. Anymore.
I'm not waiting for someone else to tell me this. Dr. Ross and Dr. Holland just told me what their hospital looks like. I can easily go on Facebook, Twitter, or Instagram and put in the word COVID prayers COVID ICU, COVID death on any day. And you can see people around this nation battling with their loved ones. So if you're waiting for a news headline, just like you can look at your favorite celebrities on here living their best life and who's divorced and who's not, you can literally, if you're a little inquisitive, another thing you can do, I trained some community health workers earlier this year, and I just want to share with them how many people are still getting COVID daily. And at that time, I've not looked at recent numbers, it was 50,000 people a day. That's a lot of people.
That is
right?
A lot of people.
That's a lot of people. And one of them could be on the plane next to you, right? And so I will say, do not wait for someone else to let you know the level of urgency with this. These physicians are telling us what they're dealing with in the hospitals every day. I'm nosy. I can go on any social media platform and put in those terms I just told you. COVID is alive and well. The flu is alive and well. And I had a friend, I think it's okay. She just created a GoFundMe because 2 of her children got RSV and were hospitalized. So I don't need, it's too proximal for me to not know that it is still a problem. So I don't, I encourage your listeners to not wait for a headline. It is here. If they want to look, you can easily search daily COVID cases. And you can see tens of thousands of people are still getting it. I have complete admiration for Dr. Ross and Dr. Holland and so many more, because they can't be on TV every day to let us know how bad it is. But the first thing they told us on here is how bad it is. So just like you can look up the celebrity and who got divorced, just COVID ICU, COVID prayers, COVID flu. And people are, it's sad, from young to old, people are losing their family members, and it's not on any major national or international network.
Dr. Bobby, we have some questions that are coming in, but kind of continuing on that kind of naysayers kind of mentality, so to speak, doctors, we have some people who, of course, don't trust the vaccines, but we have others that you were talking about wearing your mask and how important that is to you. Some people, like my Generation Zer, who says, hey, look, I need to go ahead and get this COVID, or I need to go ahead and get this flu because that will make me, kind of irrelevant from getting it. What about those people who think that us masking up and have been masked up for the last couple of years has kind of cut our natural being able to combat this ourselves from keeping a distance from each other and not being, I guess, infiltrated with the pandemic itself and building up our natural defenses?
Yeah, I'll start on that, and then I'll really turn it over to our infectious disease expert here. But, I just think a couple things. One is natural immunity is not as long lasting and as, it is if you get a shot. So a couple things, it's like when our body's exposed to the vaccine, it begins that training process. That's why I almost think of it as like military exercises that the immune system is doing, preparing to see the virus, and then the immune response, without going into all the details, tends to be more robust. And so, yes, you do have some immunity when you get a COVID infection, but within 90 days, that immunity has kind of waned. And with the vaccine, the immunity can also wane, but it's usually a little bit more longer lasting. And so that's one thing I would say is like, yeah, you're going to get it. And then when you get the flu, there's multiple strains, right? So when we get a vaccine, it's because it's like a cocktail of all the most common strains of a given virus. And so just because you had flu A, right, that doesn't protect you against flu B or H1N1 strains, which are all in the vaccine. And so I think there's some nuance in that. And I think that's what I would start with. But I'd love to hear what Dr. Holland also has to add.
Yeah, thanks. And I think Callie had put that question in the chat as well. I think it's a really good question. So a couple points, I guess. One is that there is value, for kids being out in the world and being exposed to things in the world. Kids are good about that. They're going to play in the dirt, and they're going to come in contact with germs and train their immune system in that way. There is not a need for kids to get extra respiratory viruses. So I think I wouldn't worry about masking as preventing people from building up immunity. We're well exposed to things in the world just from life, and we don't need to take steps to get respiratory viruses on purpose. The Then I think, Adia, you made a good point. I heard that a lot as well early on in the COVID pandemic. Like, I just want to get it over with. I just go ahead and get it, and then I can forget about it. And unfortunately, you don't get long-lasting protection from being infected. So this is, when I was little, before there was a chickenpox vaccine, when one of my siblings got chickenpox, my mom was like, "All right, we're just all doing it. Like, all the kids are going to get it. We're all going to do it at the same time." And then you don't get it again, right? You get lifelong immunity from that. But that's not how it is with COVID or flu or RSV with these respiratory viruses. You just get short-lived immunity. So, Melissa, you had flu, and you get a short-term immunity boost from recovering from that. But then, unfortunately, like, you can get flu again. You can get COVID. You can get RSV on top of that. And so that strategy of let's just get it over with and just go ahead and get it done, it just doesn't work long term with the respiratory viruses. Even though I totally get the wish for that. And then I think, to the point of sort of how why did we stop talking about COVID? The glass half full part of that, to me at least, is that we have gotten better at some things, right? So the vaccines do work to prevent illness, and at this point, everybody is either vaccinated or previously infected or both. And so the severity of illness has dropped. We don't have, our ICUs are not overflowing with COVID in the way that they were in last winter. Unfortunately, it's been replaced by flu and RSV, and so we're just seeing other respiratory viruses. But part of it is sort of the human just fatigue of hearing about the same thing over and over again, and part of it is, and maybe the bishop can comment on this, so just how as people we're prepared to just accept as normal that there are going to be thousands of people getting infected and hundreds of people dying a day in this country, and it just sort of becomes what we're used to. I'm not sure what it is in human psychology that allows us to just sort of say, well, okay, that's just sort of the way it is, and accept that.
Dr. Holland, I think what you just mentioned, sometimes people are just tired of hearing about it. But one of the things I would caution people to understand is that I have people in my congregation that are in their 70s. They've received both COVID shots. They've received the booster, but they still got COVID. And so just because it's out here and that's the way it is, doesn't mean that we don't need to do the things that we need to do to protect ourselves, whether it be RSV, flu, or COVID. I think we need to do our due diligence to make sure that we stay safe, and also that we create safe spaces for people. If you have people in your congregation that are okay not wearing masks, we have that. Some people we don't mandate. We stopped in May, I think, of mandating people wear masks, but people still come in with masks, and I'm perfectly fine with that. Generally, when I'm out and about and I'm talking to people, I do the fist bump now. I don't shake people's hands, and sometimes that's a big thing in churches, because at the end of service, my normal thing would be to go to the back door, tell everybody thank you for coming, and so at that point I put my mask on and I'll give them a fist bump. But I can't really afford to shake people's hand because of my job and because of what I do. I'm out in the community so much that I want to make sure that I'm doing everything I need to do to protect people that are coming into contact with me. And I think a lot of people in our community feel that very same way. They want to do it, I think, but you have to make sure, because I deal with people on the younger spectrum, but also on the older spectrum. So when I approach them, I have to find a balance to say, okay, you're a young guy, you think you're out there, you're not going to get sick. I've had people, young people in my church, 18, that have gotten COVID and have been really sick. So I can bring them up and let them share the experience, and then tell other young people, yes, it's worth getting vaccinated. And so you can kind of have those conversations. Of course, you have the conversation with the older people. They'll say, yes, I want a vaccine, because it's a little more treacherous and dangerous for them. But I think when you can bring people together and have conversations like that, you can bring the spectrums together and then get the voice of the young person, the voice of the old person. And then in that is wisdom for all people. So I think that's very, very important that we sort of share that experience. But people they don't want to talk about COVID. But I think as leaders, we can't let them forget that it's still out there. And there are other things associated with it as well.
Bishop, in the church, how do you keep people motivated or encouraged mentally? Because all of this that's going on is affecting people mentally. It's taking a toll on them. And of course, they come to the church for that encouragement.
Yeah, I think when I look at it, okay, my job is to preach the word of God. So I think in the word of God that we find hope, we find help. And I think we also have to understand that when people come to church or when they come to their spiritual leader, they want to know, will we ever get past this? And so we have to give them a word that says, yes, we will get past it. But while we're in it and while we navigate through it, these are the steps that we need to take. And I think that gives them a sense of security. If you say, well, look, wear your mask if you're feeling apprehensive about coming to church. Make sure that you're using the hand sanitizer. We're making sure that everyone scans their forehead when they come into the building. So that gives them a certain level of security as they congregate. But yes, they won't help because they're battling things in their mind, because along with this, and we haven't talked about this, and I know this may not be the forum, but along with this, dealing with these RSV and flu and COVID, they're looking at inflation and everything else. And so all of these things are attacking them mentally. And if you're not healthy mentally, you won't be healthy physically. So I think it's my job to make sure that I convey a message of hope to them when they come to church. And also to say, look, sometimes you may not be able to do anything, but you can meditate on some positive things. You can meditate and not be focusing on the negative things. And sometimes I'm glad some of the stuff is not on the news, because when you turned it on every day, it was just beating you down mentally. And so I think that's one of the things that we're doing at our church, is that we have this thing called flock groups. And so many churches have it. But what we do is there are ministers and deacons who are over like groups of 10, groups of 15. And so twice a month, they reach out to these individuals with an encouraging word, an inspirational word, to sort of build them up and keep them encouraged. And so I think that helps as well. And we do it on the 1st and the 15th. The reason I know, because I got a note reminding them to do it this morning. So, but that's some of the things that we do.
We got a question from a viewer on Facebook, Gloria Pittman. She wants to know, if you have the flu, is it feasible to take the flu shot? And I'm imagining that she's asking, does it help to take the flu shot when you've got the flu, or is it safe to take the flu shot when you got the flu? Who wants to comment on that?
Yeah, but so vaccination once you've already got the flu is going to be too late to help you with that episode of flu. That's a reasonable, really common. I got that question a lot with COVID as well, when people came in and said, "I'm ready for that vaccine now. I'm sick and this is horrible. Can I have the vaccine?" And unfortunately, at that point, it's too late. So a flu shot or a COVID vaccine are not going to help you once you're already currently infected. They're not unsafe to receive at that time. They're just not going to help you. So in the flu vaccine trials or in the COVID vaccine trials, sometimes there were people that got vaccinated and it turned out they had been recently infected, didn't know it yet. They hadn't started showing symptoms. So they got vaccinated at the same time that they had the infection. That did not cause problems. That's not a safety risk or a danger. It's just not going to help you with that current infection. And then once you've recovered, you will get some short-term protection against COVID or against RSV or against flu. We don't have a vaccine for RSV, but against COVID or against flu from having the infection. And so the sort of when should you get a shot once you've recovered, that's a little bit of a gray area. I usually tell people that they should expect pretty good short-term protection from COVID, for example, for at least a month or two. And so I don't tell them they have to run out as soon as they recover. But tell them within the next couple of months that would be a time to get a booster once they start to be susceptible to reinfection at that time.
Okay, that was a great question. So if we're experiencing flu-like symptoms, where should people go? If it's not emergent, what should they do? Where should they go? I know that a lot of emergency rooms are overrun right now, especially when it comes to the kids. So what should people be doing, and where should they seek some sort of help?
I mean, I think, a couple things. One is if you're having flu-like symptoms, please, go get a COVID test and make sure it's not COVID. That's number one. And then two, I think, I think if you're having symptoms and let me back up and say the things that would bring you into the ER is if you're short of breath and you can barely speak, right? So if I'm trying, I can't talk, or if, your child or your loved one you can barely wake them up, you know what I mean? Those kind of things, or you can't keep down food or anything like that. And they're having, but really that shortness of breath, or if you have a pulse ox and it's reading low, or it's less than 90%, then those are things that'd be like, okay, you got to go to the ER because there's probably something else brewing. You maybe have got now a lung infection or something else. But otherwise, you get yourself tested and you can go to your primary care clinic, or you could go to an urgent care and get tested. Those would be the best places to go. But I would start with getting a home COVID test. And if it's not COVID and your symptoms are still, persisting, talking with your primary care doctor and getting a flu or RSV test. And then if you have any symptoms that show that your lungs may be struggling at all, or you're having system issues, then you need to go to an ER.
Great information. As we come down to the last few minutes of the town hall, I want to open it up to everyone that's on here today to just maybe give us some information. Know before you go. We're getting ready for the holidays. We are excited. Any last minute information, places that maybe we can go and find out information if we want to find out more than what we've had here today before we end today. We can start with whomever would like to go first. Dr. Banks, open up to you.
Again, gratitude to Duke Health and Karen and Melissa for facilitating this panel. And wow, the physicians and our bishop who serve the community. We say it, the Not a Host team, keep it right. And so just think of ways to move safely this holiday season. We love and miss we love our loved ones. We miss them. But just please know that we're not quite there when it comes to being well as a country, as a nation, as a community. So wear your mask, keep your hands clean. Think about getting the vaccine as part of your informed decision making. We want to give this virus nowhere else to go, and so these are ways to help keep our risk low, so that we can cross the finish line and get into 2023 happy and healthy. Visit notahost.com if you want more information.
Fantastic. Bishop White?
All right. Thank you, Melissa and Karen and Duke Health for hosting this. One of the things I will say this, Jesus, when having a discussion with his disciples, he said, he that builds a house must first sit down and count up the costs. What he was saying is that you have to be prepared for what it's going to cost you if you're going to build. And so I think we have to think about that as we move about among our family members. What is it going to cost you if you don't take the time to be vaccinated, to make sure you're healthy? What is it going to cost your grandmother, your grandfather, your auntie, your uncle? What is it going to cost them because you didn't take time to just sit down and count up those costs of whether or not you need to interact with them when you're healthy versus staying away because you're unhealthy? So I think that's important. Whether you're coming to the church, now I believe in prayer. You'll feel the Spirit when you enter the door. But I'm also going to tell you to put on a mask if you need to. I'm also going to tell you to check your temperature if you need to. Use hand sanitizer, because I believe that prayer and common sense go together. So I just want to tell everybody, be safe, have a Merry Christmas, and we just appreciate the opportunity.
Amen.
Amen. Dr. Ross?
Again, I'm thankful for the opportunity to speak with this wonderful, as part of this wonderful panel. And I would just say, one of the places that you can go is the CDC website has a lot of up-to-date information about how to think about your risk, specifically to COVID and the flu. I think it's important that for our mental health and for us to stay connected, go out there, be with your loved ones, but be smart. As the pastor said, be really smart about what you're doing. Go get vaccinated. If you're sick, wear a mask and stay away from those that are vulnerable, and go have a good time and be thankful for where we are. And we really appreciate patients, the media, and everyone just helping us keep each other well. And I just want to say thank you for that, because a lot of people have made a lot of sacrifices in the last 3 years to help our community stay well. And so I send gratitude on behalf of all the healthcare workers for all those people that have been vaccinated. And if you haven't decided to get vaccinated, that wear a mask and do their part, because we really appreciate it. And it makes us feel grateful to know that we can partner with our community to keep everybody safe.
Dr. Holland?
Yeah, thanks so much. I can't say it better than Bishop White did, or Dr. Ross, or Dr. Banks, or anybody. I appreciate the chance to have this conversation with y'all. It's a privilege every day to get to take care of people and try to help people navigate this thing. I think my closing thought is that we have more tools than we had 2 or 3 years ago. Now we have ways to get together with our family and with our loved ones safely. You can have a holiday, get together in a way that's safe for everybody there now that you maybe couldn't have done a few years ago. And so use these tools that you have. Think about your own risk. Think about ways to minimize that risk through vaccination, through wearing a mask, through being attentive to symptoms, and then enjoy the holidays. So thanks so much for the conversation.
It's been wonderful. Every last one of you on this panel has given us a plethora of information. And for me, like Karen said, if I would have had you a couple of weeks ago, I might not have gone through what I did. But we are truly blessed to have each and every one of you, the knowledge and the wisdom that you have shared today during this town hall. We thank you so very much.
Thank you. Thank you so much. Thank you for all of your advice and guidance. And like Dr. Banks said, don't wait for a headline. Get your information on your own so that you can stay informed. Thank you so much, everyone, for joining us today.
Thanks, y'all.